Welcome to another edition of Florida Newsmakers. I'm Trimmel Gomes with our very special guest, Elizabeth Dudek, the Secretary of the Agency for Healthcare Administration. Welcome to the program.
Hey, good afternoon.
For those who don't know, could you tell us a little bit about your agency and its functions in the state? I'd
be glad to. The $22 billion Agency for Healthcare Administration is responsible for management of the Medicaid program, where we serve over 3.1 million Medicaid recipients. We also regulate over 40,000 healthcare facilities within the state, everything from the Certificate of Need program to licensure and reviewing their plans for construction.
And I know right now you're dealing with the massive rollout of Medicaid Managed Care. Tell us about that.
Yes, it's really exciting. Essentially, the legislature, with the support of Governor Scott, directed the agency to reestablish the Medicaid program into basically an insurer like many other plans where we have competitively procured for plans to support and serve the Medicaid recipient in two different groups. One, long-term care, which we're rolling out now, which is traditionally what you know as nursing home services or in-home care for individuals who are 65 years of over or needing nursing care, or individuals who are 18 or over and eligible for Medicaid because they're disabled and need nursing home care. That's the first component that we're rolling out right now and that you probably hear most about right now. And then a whole second component that will take care of the rest of the Medicaid population. So long-term care, it's about 90,000 people that we're serving. The rest, which is managed medical assistance, will be all of those other services that people get and take care of the majority of the Medicaid population.
So what's the overall goal of Medicaid Managed Care?
I think there are probably a couple of goals. One is to have a single point where individuals can get their care, eventually comprehensive care, where they'll get all of their care from one provider, similar to what you might do now with an insurer that you might have. It also will allow people to have choice of the type of provider or the exact provider that they want to have.
All right. Now, there were talks and people were concerned about, the Medicaid system being fragmented and fraught with, having fraud. What's being done to get away from that perception?
Okay. Well, one of the things, and you mentioned fragmented, actually is by going to managed care, we're getting rid of some fragmentation. Right now, you can be fee-for-service, you can be in MediPass, you can be under a waiver, you can be under nursing home diversion, you can be under managed care. We're going to go to one system, so it won't be fragmented that way. And we have set goals ourselves, as well as the legislature has pointed out, those types of things that need to be in place to avoid inappropriate behavior on the part of the plans or any of the providers within the plans, and very strict guidelines that they have set, as well as what we are setting in addition to that, to make sure that they are policing themselves and that we can police what they do.
So this isn't all happening at once. It's being phased in, different regions around the state.
Right. We have 11 regions around the state, and each region then has a separate procurement with a separate number of plans. For instance, we just rolled out in Orlando on August 1st, and we will be rolling out, we've got two areas rolling out. I believe it's areas 8 and 9, which is the greater Fort Myers and West Palm Beach area. Area 7 was the Orlando area. So we're going, and that's next month. But it's a whole process where in the beginning, we send out information. You will be somebody who can go into managed care. Here's the information for you. Here are the choices that you can make. We are doing a lot of outreach so that everybody knows what is available, can ask questions, and that's both on the part of providers who are involved in the system and the recipients themselves, so that they can make the best choice.
How can they make the best choice? What are you guys doing on that front? What sort of outreach are you guys actually doing specifically?
There's several things. There are choice counselors that they can contact, either going through the website, that they can call, or actually if they call, can make an appointment so people can go into their home and tell them their array of services, the providers who are there, the array of services that the providers have, so that they can make the best choice. We are also doing outreach with our choice counselors, going into community centers, going into facilities, going to people's homes to let them know what is available so that they can make the best choice. Webinars, we're trying to do all that we can, and putting it out with people like yourself so that we can get information out there about coming to the agency. And everything is actually available on our website.
So what's the website to get more information?
Sure, it's ahca.myflorida.com/SMH.
All right, thank you for that. So when do we see the complete rollout of this plan?
Well, the rollout of long-term care will be sometime at the beginning of next year, so late spring, and then we'll be working into the managed medical assistance portion that will then roll out sometime through the rest of 2014.
Well, Secretary Dudek, thank you so much for your time. And to our viewers, we'll catch you next time.